Hi, my name is Alex Economos, and this is my presentation for the Unit 2 Case Connections assignment. I chose to answer cases 3 and 4. In case 3, we are given information about a 5-year-old patient who was brought to the doctor with symptoms of drowsiness, persistent thirst, and frequent urination. He has baseline blood work done while fasting to check serum insulin levels and was rechecked an hour after being given glucose. Based on the information in this case, it is likely that the patient has type 1 diabetes. In the baseline blood sample, the patient has serum insulin levels of 0.8, which is much lower than that of the control at 6 plus or minus 2. An hour after the glucose load, the patient still has low serum insulin levels at a value of 5, compared with that of the control at 40 plus or minus 11. This data could suggest that the patient is type 1 diabetic because individuals with this condition cannot produce insulin from the pancreas to regulate blood glucose levels. I would predict that the patient has fasting blood glucose levels above normal range. Given that the patient has insulin levels extremely low after the glucose load, we would likely see that the glucose levels are above normal range and he would be considered hyperglycemic. Although glucose concentrations are high in the blood, cells are unable to absorb and metabolize it due to lack of insulin. The patient's mother also mentions that he is persistently thirsty and has frequent urination. Hyperglycemia would be one explanation for these symptoms. Pyruvate carboxylase and phosphoenolpyruvate carboxykinase are two regulatory enzymes that are likely active in the patient's current condition. These two enzymes are active in gluconeogenesis. They help overcome the regulatory steps in glycolysis so that gluconeogenesis can occur. In individuals with type 1 diabetes, glycolysis and glycogenesis are decreased. There will be limited glucagon secretion from the pancreas, which is signaled by insulin, so the liver will continue to produce glucose through gluconeogenesis and glycogenolysis. In case 4, we are given information about a 2-month-old patient who is experiencing jittery spells after breastfeeding, especially recently when sleeping more than 2 hours between feedings. Her blood work reveals that she is hypoglycemic, and physical exam shows an enlarged liver. She is unable to maintain blood glucose levels while fasting and was given epinephrine, which did not increase blood glucose but did increase blood lactate. Based on this information, it is likely that the patient has glycogen storage disease. In one subtype of glycogen storage disease, the patient is missing glucose 6-phosphatase, the enzyme that breaks down glycogen and releases stored glucose. Common symptoms of glycogen storage disease are hypoglycemia and cramping. Based on the patient's symptoms and blood work, these symptoms would match the diagnosis. She cannot maintain blood glucose when fasting because she is unable to use the stored glycogen which is needed in between her feedings. Glucose is still being stored in the patient's liver as glycogen, but it is lacking glucose 6-phosphate to release glucose, so the glycogen buildup in the liver would explain her enlarged liver on examination. Since gluconeogenesis is impaired, the lactic acid will continue to be elevated, which was also exacerbated by the dose of epinephrine. Galactosemia is not a likely diagnosis based on the findings in this case. Although this condition could account for the patient's jittery spells, there was no vomiting, jaundice, or poor weight gain. She does not seem to have a problem with digesting lactose. Glucose 6-phosphate dehydrogenase deficiency is unlikely because the patient is not jaundiced and blood work does not show hemolytic anemia, both symptoms of this disorder. Since the patient has only been fed breast milk since birth according to her mother, a diagnosis of hereditary fructose intolerance is unlikely because there has been no exposure to fructose in her diet, although it is important to note that individuals with this condition can be hypoglycemic and have an enlarged liver as well.